what are the causal factors in alcohol abuse? The biological ones, it seems to be related to MCLP, which is the mesocortical limbic pathway, which is the pleasure center that I've already mentioned, that is activated. And this is the primary area of the brain that adjusts to usage, and in other words, where tolerance and dependence is witnessed in terms of needing more of the same substance in order to have the same experience. There is a genetic vulnerability. If you have a history of alcohol abuse in your family, you are basically, if you start to use alcohol. In other words, there seems to be this sensitivity that will likely not feel some alcohol as other people who don't have a family history or experiences that are different. Those who have, when you have a genetic predisposition, you feel better. You have this greater sense of stress relief with alcohol, so it has a more positive impact, and certainly environment plays a role. If alcohol is used in your family, your parents are as a relaxer and so forth, you're going to be more likely to use it. The muscle factors, as I said, use. If you have for using alcohol, it's a coping mechanism. Physical abuse are mixed outcomes when looking at personality. So we need to be tentative in this. It does seem, though, that there's some correlation different than causation. It may be actually other factors, but correlation with immaturity, your expectations that you bring to drinking. If you expect it to make you more socially comfortable, yield greater relationships with other people because you anticipate that that's what you're supposed to do as a college student, or that's what you're supposed to do when you go to this setting or this country, you're more likely to abuse it. If you have a high need for praise and, again, kind of belonging, if you have low frustration tolerance, again, you're more likely to turn to it for a coping mechanism, and just not feeling adequate there. It is often present, substance abuse, alcohol abuse is present with antisocial personality social disorder, which is a dangerous combination. You're talking about people who don't care about other people, they don't respect social norms. Then you put alcohol on top of that, which is a disinhibitor, meaning likely that your expectations, more restrictions, etc. And as I said, I also already said that studies have looked at when expectations are given to some people in some alcohol drinks that taste like alcohol, and we find that when people believe they're drinking alcohol, they aren't act drunk. So that does say something about this bias of what you expect to happen when you drink. And again, marital difficulty, especially coming from a divorced home or being in a divorce, does make is a risk factor for you abusing alcohol. And this there's definitely a perception in the West that alcohol is the social lubricant. It is you makes you fun, loosens you in social situations. So again, going back to those expectations, right? And right about I need alcohol and to be fun and to be dirty, and those drive have a large influence in whether people are going to use those. There are certainly teenagers where there is very low alcohol usage when the values are very opposed to using alcohol. Among Muslims, Orthodox Jews, there is a higher usage in Europe. Definitely, and although that does not necessarily mean that there's necessarily more substance abuse, but there is definitely a higher usage. And again, this is emphasizing when you're under alcohol's influence, your expectations, the culture's expectations of what should happen. Like I said, should you be more fun? Should you be more the life of the party? Is it going to allow you to be more attractive? That sort of thing does impact whether you're going to use it, as does personal expectations as well. Alcohol, I need alcohol to relax, that sort of thing. And then finally, what are the treatments that we currently have for alcohol abuse? Initially, there was a lot of hope that medication was going to be helpful. This first one here, anti-abuse, again, was not created to treat alcohol, but it was discovered inadvertently that people who had this medication would get violently sick when they would use alcohol. And so the hope was that there would be a way to classically condition people taking a medication. Then if you would drink, you would become violently sick, vomit like you had the flu, and this would make people less likely to drink. The problem is, once you send people out into their normal lives with this medication, people are intelligent enough to know that, hey, if I want to drink, I will just not take this medication for a couple days and I can drink and not get violently sick. So it's not effective. That kind of aversive conditioning is not effective. Naltrexone does seem to help reduce craving. It is again not 100% effective in all cases, but it seems to take off the edge of the craving that happens. Tranquilizers are not used to reduce the abuse, but rather to deal with side effects of some of the physical withdrawal of the side effects. Again, the challenge is that tranquilizers are addictive, and so once you're addicted to one substance, you are at risk of becoming addicted to other substances. What are the psychological interventions? Group therapy seems to have some efficacy, talking about how to prevent relapse, hearing that you're not alone. Environmental interventions like actually working on helping people change their environment, find places, housing places, learn how to cope with the stresses in life instead of going back to their normal habits of using drugs and going back to that same social network. Behavioral cognitive interventions that again are specific to skills of how to cope and how to recognize signs that you're at risk of using again. Most recently, there has been a movement to say maybe abstinence is not the best way, and so some studies have looked at controlled drinking. For some people, that's actually better than saying no alcohol at all, because then once they kind of fall off the bandwagon, they feel like they're a failure and they just use excessively. But there's a lot of controversy around that. 12-step programs like Alcoholics Anonymous, it's a very mixed research bag. There are some studies that show that it's helpful, others that don't. The best controlled studies do not show a lot of effectiveness, despite the fact that the general public believes it is. So that is really an area that's not real clear. We know that follow-up sessions are important. So when you're in outpatient therapy, even if you've been clean for 3-4 months, to continue to have check-in times with therapists are important. And relapse prevention is one of the biggest areas of focus, because the majority of people who have struggled with alcohol abuse will relapse. The question is not often will they, but when will they? And how do you keep them from, as I said, just kind of psychologically giving up and saying, this is who I am, I'm going to just be an alcohol abuser, and I just need to accept that. So relapse prevention is so critical, about talking about when you take a drink, have you fallen off the wagon? What do you do to get back into managing your life well, rather than letting alcohol dictate your life?